Live from downtown Detroit, home of WDIV and Click on Detroit, Local 4 News at 6 starts now.
The doctor who coined the term flatten the curve is weighing in on the economy as Governor Whitmer and Mayor Duggan talk more about making workplaces safe from COVID-19. Thanks for being with us for the news at 6. There are new signs of progress in the fight against this awful virus, and the experts say it's thanks to social distancing.
As the curve does start to flatten, there's renewed focus on how to keep it that way once people do start making their way back to work.
Detroit Mayor Mike Duggan says testing will be the key to achieving COVID-free workplaces, and the city is reaching out to businesses to help make it happen.
Read the stories about employees at Myers and Home Depot that have been affected. We got folks going to work every day at gas stations, grocery stores, banks, a whole series of businesses that we need. They aren't able to shelter in place. They have to be out and interact. And starting Monday, I want every business in the city of Detroit to know that if you have to be open because you're essential, that we will test all of your employees. That if you contact us and say, I'm an essential business that's open today in the city, we will make arrangements for your employees to come through the fairgrounds, get tested, and we are going to have COVID-19 free workplaces.
There have been another 134 confirmed deaths from COVID-19, meaning we've now lost 2,227 people to the virus.
Yeah, and Michigan now has more than 30,000 confirmed cases, but the number of new cases is the lowest daily tally we've seen in a while.
And we've learned several of those cases happened in one local family.
Yeah, they're from Wixom, and all 10 of them contracted COVID-19. Jamie Edmonds spoke with them. Jamie, my goodness, do they know how this happened?
Good evening. They don't know how this happened. It's not like they were hanging out in big groups. They did go on vacation and then got it when they came back. So it could have happened there or could have happened here.
She came down with some of the typical symptoms of a cough.
Betsy Rydell says her 8-year-old daughter Mackenzie was first, but certainly not the last to get sick in the family. Her in-laws were next, and then it was Betsy herself.
I spiked a fever and had a cough. And I was tested. I tested positive.
Rydell says the virus then traveled to each member of the family. 10 total people, 4 different households.
My sister and her husband and kids in their home, and my in-laws in their home, my mom down the street. We relied heavily on friends for getting us food, getting my mom's medication picked up or delivered. If it weren't for that network of people, I don't know how we would have functioned because our entire family network was shut down.
It was scary, Rydell says, especially since many members of her family are immunocompromised. Little Mackenzie is a leukemia survivor. Betsy is a diabetic and has asthma, and her 78-year-old father-in-law just finished chemotherapy.
My father-in-law is still very sick, but he is recovering, although slowly.
This family has shown no symptoms for several days, but they still take precautions. But take it from them. Don't put yourself at risk if you don't have to.
You might not show symptoms, but you go home and you give it to your mom, you give it to your dad, and they could end up in the hospital for weeks or worse.
Now, this family feels blessed because they recovered, especially little Mackenzie, but they are still worried about their father-in-law. He is still in the hospital. We're live tonight. Jamie Edmonds, Local 4.
Blessed indeed, Jamie. My goodness. Well, I'm told Betsy wants to help out now that she's recovered.
She's a physical therapist and she would like to help out. So she said, you know, maybe I can help out at the Suburban Collection Field Hospital. She has to wait for that antibody test first, but she knows more than anyone about what this virus is.
Yeah, so good to hear that they are all okay. 10 family members. That's incredible. All right, Jamie, thanks.
And public health experts are pushing the public to remain patient with our current restrictions to try to prevent a second peak of illnesses.
But could staying home longer actually end up benefiting us economically in the end? Dr. Frank McGeorge has a closer look.
Dr. Howard Markell is one of the researchers who helped coin the phrase flattening the curve. He's the director of U of M's Center for the History of Medicine and says history suggests patience can pay off. The 1918 Spanish flu pandemic hit the U.S. hard. Markel's data on how cities responded has also been used by economic researchers to look at how cities recovered.
What they found is that the cities with the best records, the ones that acted early, did a layered response of NPIs, non-pharmaceutical interventions, and did them for a long period of time. Those cities bounced back into the economy post 1919 influenza in a much stronger way than those that were struck very hard.
Although the world and our economy are far different now, Markel says reopening too soon still runs the very real risk of needing to shut down again for even longer.
It's economically costly to many families in Michigan. I get that. But it is better to stay the course and be patient so that we nail this thing down and we can resume our normal lives. I'm confident that we'll come out of this stronger than before. But we've got to take care of this public health problem first.
When it comes to human lives, he says better safe than sorry.
What we're all trying to do here is prevent the spread of disease, and most importantly, prevent the spread of deadly disease for our loved ones.
Now, some have pointed to the low number of patients at the TCF Field Hospital as an example that we don't need these restrictions anymore. Markel says it is just the opposite. It's a sign that what we're doing is working. Back to you.
All right, thanks, Doc. Well, Governor Whitmer today said she and her team are at work on a plan to start sending people back to work in phases.
We still have a lot to learn. She said more details will be coming next week, but she did make clear that it will be a slow rollout that may look different in different parts of the state.
When we start returning to work, we will begin with low-risk sectors. And as a state, we may re-engage our strategy by region, depending on what the data tells us. It is too early to lay out precisely what that will look like, but we are doing the hard work now so that when it is safe to re-engage, we're able to do so in a strategic way. Any return to work will be phased in carefully so that we can track the impact of lifting social distancing measures and what that means for the spread of COVID-19.
Many, including auto companies, of course, are wondering what workplaces are going to look like in our new socially distanced working world. Business editor Rod Maloney joins us live with what plant restarts could look like. Rod.
Yeah, you know, Devin, the Fiat Chrysler has already said May 4th is their date. That was like over a week ago they made that decision. It remains in effect. GM and Ford, well, they're not so sure yet when they're going to reopen, but they are working together with the UAW to see that everybody gets back to work safely. Overnight, General Motors shipped its first ventilators from Kokomo, Indiana to a Chicago hospital, and Ventec CEO Chris Kippel was emotional about the team's accomplishment.
We really took some of the best of American innovation and the best of American manufacturing and the best of people's hearts, and we put them together with one team and one mission.
Over at Ford in the Plymouth Face Shield PPE assembly operation, they're testing out wristbands that vibrate when people get too close together. We tell you about these efforts because these plants and their current social distancing protocols will serve as the template for the automotive facility future. GM, Ford, FCA, and the UAW have a task force looking to these plants as a guide for the larger reopenings. While they've not completed their work, here's what's likely coming for auto workers, blue and white collar. 1, they're going to have to go online every day before going to work and self-certify they're healthy and haven't been exposed to anyone testing positive. 2, everyone will get their temperatures taken by a thermal scanner before getting into the building. A fever will get you sent home. 3, once inside any facility, you'll be required to wear a face mask at all times. Only when doing things like eating or drinking can they be removed. And finally, workers will socially distance wherever practical, and there will be larger time gaps between shifts for increased disinfecting and keeping workers from differing shifts apart. Now, the United Auto Workers put out a statement saying essentially that they want the guide for all of this for executives to consider whether they would send their family, their children into those plants and work. And that should be the guide and not economics. And so they are working, they are talking about this. They haven't finalized everything. We'll expect to get something here fairly soon. But here's one thing to consider in all of this. Common sense tells you that if you're going to put on these kinds of strictures, that it's going to lengthen the day and it's going to mean that people are going to have to show up early and expect to leave late. Reporting live in West Bloomfield, Rod Maloney, Local 4.
Certainly seems likely. All right, Rod. Now to an alert for 112,000 Beaumont patients. The hospital system says a third party accessed some employee accounts that contained patients' personal information. That would include names, birth dates, and treatments. Beaumont says the Social Security numbers and financial account information for a limited number of patients was accessed last year. Beaumont says it has dedicated a phone line for people who have questions, and you can find that number on our website. It's at clickondetroit.com right now.
A new bombshell report about the Flint water crisis reveals disturbing allegations about what former Governor Rick Snyder knew and when. This is all laid out in a new report from Vice News, and now Michigan's Attorney General is reacting to what has been revealed. Consumer investigator Hank Winchester has more.
This new information will really get people talking and will again turn the attention to Flint and the water crisis. New surprising developments in the Flint water crisis just revealed. This after a report from Vice News, which claims Governor Snyder was warned about the dangers of using Flint water in 2013, a full year before the switch, and that Snyder knew of the Legionnaires' outbreak in the fall of 2014, about a year and a half earlier than the governor claimed while under oath during congressional testimony. Vice also details the former governor's often contentious relationship with former Flint Mayor Karen Weaver. Vice claims that Snyder tried to get Weaver to tell the people of Flint that the water was safe to drink, even though testing showed it was not. And that at one point, Snyder asked Weaver to contact Congressman Elijah Cummings, who at the time was the incoming chairman of the House Oversight Committee. Vice reports that Snyder asked Weaver to tell Cummings to back off, as at the time he was heavily involved in the Flint water crisis investigation and hearings. There are also details about the ongoing investigation, now in the hands of Michigan Attorney General Dana Nessel, and today we received this statement from the AG's office. We want to correct the misconception that April 25th, 2020 is the deadline to bring charges against those who will be criminally liable. Criminal statutes of limitations vary depending on the offense and the date of the alleged criminal act. Though we cannot comment on the specifics of our investigation, we remain on track and we are delivering on our commitment to the people of Flint. I should tell you, we did reach out to former Governor Rick Snyder and also former Mayor Karen Weaver for a comment, but we did not receive a reply. I'm Hank Winchester. Help me, Hank.
All right, Hank, what a story. Well, Ben didn't want to have to explain another day of all this snow in mid-April, so Paul is valiantly stepping in today. Hi, Paul.
Yeah, we'll give Ben a free pass here because when you see the temperatures this weekend, I think you'll be okay with that. But you can see the snow is moving out of the area, so we do need to dive into that weekend because we do have a rain chance. We'll get very detailed on the timing to help you plan straight ahead.
Okay, Polly. Plus, lots of people are taking more walks to escape the isolation of stay at home, but one local couple has turned their daily escape into something more. We'll explain coming up.